Hello, everyone, and welcome to Conversations with Friends, where we are constantly in search of people who are doing something quite special in the world, in our community, all to do with helping usually to heal the world or do something very good for the world. And I have someone right here with me who's doing a lot for people who are in great need of it. And so I want to introduce you to Dr. Edith Shiro. And Dr. Edith Shiro I hope you can see that. She's the author of a new book, The Unexpected Gift of Trauma. It's pretty shocking, right? Can trauma be a gift? Disasters happening everywhere, and mass murders and all the stuff that we know, wars, everything going on. I mean, you can't even get through a day anymore, without hearing about some horror. But then again, really, when you think about the people who are suffering through that and many other ways that they're suffering, it's not just, mass events happening. But anyway, Dr. Edith Shiro, I'm delighted to get to meet you and interview you because I've heard a lot about you, mutual friends that we have, relatives that we have, well, your relative.
Yes.
You have a whole different attitude about trauma. But I wanted to start out by saying, what exactly would be the difference between trauma and just suffering, or going through something like maybe the loss of a parent, or I mean, people suffer from all kinds of things. Is there a difference? And is that considered trauma?
Yes. And Meredith, I'm so grateful to you, and I'm so honored to be interviewed by you. Really, I heard so much about you too, and really happy to be talking to your community and to be talking about topics like this. That is not just individual trauma, but collective trauma too. But more importantly, how we heal from these things. Because yes, like you said, there's so much going on in the world right now, and we all are dealing with so many things that it seems like now, more than ever, at least in our lifetime, things have gotten much more intense in terms of suffering, in terms of having many things happening at the same time. And part of it, Meredith, I think is because there's a lot of, we have a lot of information from all over the world. So we get to be sensitive and empathizing with so many people all over the world, or we get being affected by so many things happening everywhere, not just in our own little community, that it might feel overwhelming. So the way that I define trauma is any event that shatters or shakes your belief system about yourself, about the other, or about the world, for which you don't have a resource or you don't have a tool to deal with. So whenever, it doesn't matter if it's like a huge thing, a collective, earthquake, or mass destruction or war, or it's an individual thing, which is bullying or divorce or moving from one country to another, or having a parent that wasn't very nurturing. It doesn't matter if it's those big T traumas or small T traumas, but they actually, whenever that shatters your belief system, whenever you feel like you're at a loss in trying to understand what happened to you and trying to have the tools and the resources to deal with it, that's when it becomes a trauma. And the difference between suffering and trauma is that, of course, we all go through suffering, and of course we all live through pain and difficulty and adversity in life. That's what life is about, how to overcome those things and how we grow from this, right? But the difference is, like, those of us that stay stuck in a cycle of repetition, of trying to overcome it, and then it becomes a chronic problem, that's when it becomes a trauma.
So they don't move on.
Even in a clean,
that they don't.
Yes.
I mean, let's say you lose a family member, okay. I mean, and it could be a husband or wife, could be, I guess we could say worse, a child, right? But depends on the person, could be parents. There's usually a time, right, that people expect, well, you're going to mourn for a while and you're going to go through things. And, there were people that I remember saying to me, well, you seem okay, when my husband passed. And, well, I worked on being okay. I really did. But inside, there was work to be done. I had to kind of come to terms with it, and it took time. And there are other people I hear, they'll say to people, get over it. You've mourned for for a year or whatever, and enough is enough, right? You know, I've heard that
Right.
from in different
Yes.
ways.
Yeah.
So it's not really a matter of time, is it? Or
No.
is there a certain amount of time that
No.
okay to be, you know, traumatized?
No, not at all, not at all. And I'm glad you're asking that question. No, it's not a matter of time in the sense that trauma is that, like, the way I define it is very subjective. It's like I cannot tell you what is traumatizing for you, and you cannot tell me what is traumatizing for me. Your own experience is unique and is yours. And if you need a year to heal, or if you need 2 years to heal, that's okay. That doesn't mean that you are stuck, as long as you're doing as you're processing and you're doing the work. What happens in our definition of post-traumatic stress disorder, like the official definition of that, is that it usually says within 6 months, people should be able to start overcoming their loss. And within a year, it's like on the, you know, the expected time to do that. But, you know, those are like very broad diagnoses that are part of the book of like psychiatric diagnosis. I don't really follow that 100% in the sense that everybody really has their own process. Everybody has their own way of dealing with trauma. And you know, one thing is to say, I am so traumatized, I am stuck in my loss, I cannot move forward, I cannot function in life. That's really traumatizing, and that allows you to stay in this chronic trauma response that I'm going to talk to you about it later. And another thing is to say, I'm working through my issues and I'm working through my loss, and you know, I'm taking my time and I'm dealing with it, and I'm in touch with my feelings, and this is what I'm going through, and that's perfectly fine.
So there is a process though, and there is a way of, and according to your really fascinating book, you know, according to the way you think and you begin to heal, you can really turn this around. You don't have to live with trauma forever. I mean, I guess if you choose not to, right? Is that it?
Exactly. Right. So I love how you say it, Meredith, because the reason for me to write a book that is called The Unexpected Gift of Trauma is to send the message to people that trauma is not a life sentence, that you can actually go through something, that use that as an opportunity to turn it around, to transform it, to transcend it, and to see that as an amazing trampoline, almost like to jump into another level of understanding.
So I
And
assume
that's super
that it helps if, you know, if they
important to know.
understand that right from the beginning of, you know, they go
Instead
for
of
help.
being a life sentence, it can be an opening. And
Yeah, I think we're having a little difficulty, I didn't say that you're coming to us all the way from Brazil. You're at a conference with World Happiness, right? The World Happiness Conference.
Yes. Let's see if I can. Yes, I'm at a World Happiness Foundation conference. It's a World Happiness Fest. Let me see if I can move a little bit and get a better.
It's getting better. The voice is getting better right now. It seemed to be okay, I think. Yeah.
Is
Yeah.
it
And
better?
so is there a difference? Yeah, to me it is.
Okay.
Is there a difference between, you know, because you write about, even you've worked with communities who suffer together, and that could be like anywhere from suffering through an earthquake, right, to all kinds of natural disasters, and so you're in it together. Does that make it easier or worse than if you're just suffering, you know, or you feel like you're alone?
So part of experiencing trauma is this fragmentation and this isolation that it creates. And the amount of support that people have, it really makes a difference in how you experience trauma and how you overcome it. One of the experiences I've had that I'm sure you know is the collapse when the building fell.
Right, in
In
Surfside.
Miami. I
We
don't know
can
if you
never forget
remember that
We'll never
experience.
forget.
And in Surfside, yeah, exactly. So yes, we will never forget. And that was part of I was working with families that lost a family member, and it was very hard to deal with that. And one of the things that really helped was creating a sense of community with these family members, in which they didn't feel like they were alone going through this. And the thing that they said was like, the only people that can understand what I went through is the same families that went through the same experience. And those are really the people that can understand me. I feel accompanied. I feel that I can talk to them about anything. And that really, really make a huge difference in their healing process. It also give other people examples like, oh, if they can do better, I can do better. If they can heal, I can heal also. It really was a beautiful process to see. And, same thing happened when I was working in New York during 9/11. We had I was working with some of the survivors of the Twin Towers as well. And I was working actually with Latino immigrants that were living in New York at that time, and they lost family members at 9/11. So it was like a sense of community that was created among these families to say, how can we go through this together? And that really, really is one of the key things about collective trauma that needs to be taken into account, that, you need to look for the rest of the group. You need to stay in connection with others in order to overcome.
So it's like a support system, which is interesting because I can remember talking to somebody at some point in my work or whatever, saying she was part of something. I think her sister died, maybe suicide, something like that. And she was a part of a support group, but then she left it because she didn't want to sit around and listen to people's stories. It just made her more sad, and maybe it was, she was already past it and she didn't need to talk about it anymore, right? I guess that can happen too. Yeah.
That can happen too. I mean, you need to find the way, whatever works. But, the important thing, Meredith, the most important thing is the intention and the willingness to work through your emotions and work through your experience. The difference between the person that heals and the person that doesn't heal is that the person that stays stuck continues to repeat the trauma responses that initiated that event. For example, if you lose a family member, if you move to another country, if you get divorced, if you're being bullied, you have to respond by defending yourself, by dealing with the danger, right? And the typical responses that we all know are fight, flight, freeze, fawn. I'm sure you've heard about these responses, right? It's like how you deal with difficulty. Fight, flight, freeze, and fawn, right?
What's the last one? I couldn't exactly get that. The last
Fawn,
word.
Fawn. It's like being fawn, which is like being very complacent.
Oh,
it's like
I
how
see.
you're very complacent about everybody. You say yes to everyone.
I see.
So these are typical trauma responses that we all human beings, all animals use in order to deal with danger, with emotional danger, with psychological danger. And the way that we deal with it is that our bodies are wired to respond like that. And this is how we survive difficult situations, right?
What about, that's interesting to me because I'm thinking, what about the more that we're in touch with our feelings and we can release them? Maybe that's just because how I work on things that I've been through. I try to really figure out what's going on inside me. And I don't usually do it sharing, I mean, at times if I meet somebody and it, usually after I can share, but when I'm going through it. So I don't know if that's, and I mean, I don't know if that's, it works for me. So I guess people have
of course
what works in their life, but they need someone to guide them. And I feel I really want to talk about how you've devoted your career to this, right? I mean, as I understand it, dealing of not just talking about or working about trauma, but really going beyond the trauma. That's what your work is all about. That's why this book is about. So there have been other psychologists, psychiatrists who have kind of focused on this, but not in the same way that you have. What's the difference between the past way of looking at trauma and the current way and your way?
So yes, I mean that I want to tell you what you said about how you work through your things. But let me just say, I think I'm offering that is very new and that is different is two things. The first one is that I don't just talk about what trauma is, but I talk about what happens after trauma. And that's what
Mm,
I think is a lot of hope to people. It's not like,
mm,
oh, okay, I'm traumatized. These are my symptoms. This is what I'm going through. This is so difficult. And yes, there are a lot of books about that. There are great psychologists that talk about trauma. And there's some of them have been my mentors and my teachers. But what about this other thing that happens, which is the post-traumatic growth, which is how can I take what is happening to me today and really envision the growth that it's going to happen if when I go through this process and really
mm.
see that as an opening, like really an opening for the light to come in. Like Rumi says, the crack
Yeah,
is
really.
where is the place where the light enters, is those places that we think are the worst, and they tend to be the best opportunity for us to change. And that's one of the things that I think it's important to I'm kind of like redefining or doing a reorganizing this idea of trauma and saying it, yes, it's painful, yes, it's difficult, yes, we go through something very, very challenging, but at the same time, what an amazing opportunity for me to see this as something that is going to expand my life. It's going to expand my understanding of myself and others. It's going to take me to places that I didn't even know I could go, and that I can grow in ways that I never knew, and develop skills that I never knew I had. So that's one thing. And the other thing that
Beautiful.
I think it's
That's
important to
beautiful.
know,
Yeah.
yeah, that's why people really like it so much, and it's helped so many people. The other thing is that I think about trauma, and I think about these things in a more systemic way, meaning like
Mhm.
we're not alone in this. I see trauma as a relational problem. Like
Yeah.
whatever happens to you, even when you have the death of a loved one, there's something that affects your relationship with yourself and with others, right? Like
Mm.
people expected you to be with your loved one, and then it's no longer there. You have to rearrange your life, your social life, your commitments,
Yeah.
your family life, right? So all of that gets affected also. In the same way, when you move countries, and when you're being bullied, when you're divorced, when you are going through uh, to a collective trauma, when we're going through war, it's like when we're going through political issues, right? What's happening with our relationships with others? They get affected, right? So what I'm saying is that in the same way that trauma affects relationships, it also, the healing of the trauma is relationships as well. Let me just say that again. The same way that
Yeah.
trauma affects relationships,
Relation.
the healing of the trauma is through relationships as well. So it's good
Beautiful.
that you can identify how you feel.
Feel.
And
How
I,
you
I
feel.
and I think it's wonderful how you do your process, your feelings, you know what you're going through, you understand them. And then later on, if you feel like it, you can express it and share it with other people as well.
That's very interesting. I mean, this whole idea is very interesting because you really do see it as a path to great things happening in your life that you could never imagine when you're going through a horrendous, situation in your life. And in your book, you do mention some of I don't want to use this word, but like success stories in terms of something really, I don't mean success
Yeah.
monetarily,
No,
but
growth
success
stories, right?
people have done, really, really happy stories or fulfilling stories. Maybe share a couple of them. I mean, that you mentioned in the book.
Absolutely, absolutely. So during the pandemic, a lot of people were coming to me saying, "Oh, I feel so paralyzed. I don't know what to do with myself. I'm stuck in this house
Mm,
with my husband or my spouse and my children. I just want to run away." You know,
yeah,
other people were saying, "Wow, I'm so happy to have the opportunity to get to know my family members better." Other people were going through a lot of loss and not being able to be there with their loved ones when that happened. So there was a lot of trauma. But one of the things that happened during the pandemic is this family comes to me. This woman calls me and says, "Edith," well, she told Dr. Shiro, "I can't tell you, I'm devastated. I'm never gonna recover from this. I've been with my husband and my 4 children at home, and I just saw his phone, and I just checked that he's been talking and in touch with this woman. He's been cheating on me. He's been unfaithful.
Mm,
We've been married for 25 years. I can't believe this is happening to me. I'm devastated. I don't know what to do with myself. And
mm,
really, she came desperate. And she agreed to come with her husband
mm,
and say, you know what, I'm going to give him the opportunity for us to talk about this and see what happens. And they asked me, do you think that this level of trauma, am I ever going to recover from this? And Meredith, what happened was that we took the whole month, the whole year of the pandemic to work
mm,
on their relationship. And they both acknowledge her trauma and his previous trauma that somehow made him in some way, inform him in how he was dealing with the marriage. And
mm.
after doing the work for they work so hard on themselves, on each other, on the relationship. They would come by themselves, they would come together, they would come with their children also to to talk about the relationship. And after all this work, they came together and said, the work that we've done together, we have a different marriage. She tells me, I feel like I'm married to a different man because we changed so much from this trauma that we lived of infidelity, and we got to know each other so well. We really went through so much together. We started to be more intimate emotionally, sexually. We understood our family, our children are grateful to us for the work that we've done. So that was a super beautiful story of growth, that happened in
Powerful
this.
story. It's a beautiful story because, I mean, most times you would hear it's over, on the part of
Yeah,
whoever feels that someone was,
yeah,
they're being cheated on. Or, for most people, it's over and nobody is willing to go through the process. And so, what I'm getting from you is that whatever it is that you're going through, whatever it's your trauma, right? You need to get guidance or help or something. Maybe
yes.
different people, it's something different, but we often need help or support. You've kind of mentioned
Yeah.
different ways, a support system, some way to work it out. And so there's not necessarily always a bad ending, is there? It can be a good, fulfilling, happy ending at the end of the road or maybe a part of the end part of the road.
Yeah, and
Yeah.
what happy ending means that what I've learned this from my patients from
Yeah.
more than 25
Uh-huh.
years of being from individuals and groups and families.
Mm,
What they tell me over and over is this. They say, I would not wish this on anybody. This was a very hard thing what happened to me, but I would not change it because it made me who I am today. So some of the wonderful things that I've learned from my patients is like the sense of self is so much stronger. Their understanding of who they are, their priorities have changed completely. They know what's important, what's not important. They don't lose time or energy in those little things that happen. They don't get bothered by that. They have more meaningful relationships. Like the relationships are more meaningful. They are more connected. They're more like authentic in their relationships. People usually, Meredith, when they go through this process, they find their sense of purpose. They find their sense of meaning, like they know what their mission is in life a lot of the times. This is when you see people saying, okay, it was an alcoholic or they were dealing with addiction, and all of a sudden after doing the process, they become the mentors for others to do better. The woman that was sexually abused, she creates a foundation, which by the way, I do have a couple of very good friends that have done that. They create amazing foundations for other women to get support and to get help. It's like the wounded healer, the
mm,
ones that are more wounded and they work through their wound and they
yeah.
work through their pain. They can be like the wise, the wise member of the family of the shaman, the wise elder that knows
Right.
and that can teach others, right? And one of the
It's
things that most
amazing. It's
beautiful,
amazing. Yeah. I'm sorry. Yeah. Continue.
yeah,
Yeah.
yeah, yeah, just the last thing that about that is that not only the people want to heal and the people feel more wise and more growth, but they also want to give back to the community.
Yeah.
And that's what I see over and over. Like I was working with a kid that survived the school shooting, And
Mm,
him and his family were like, no, we want to help other families that have gone through that. And I want to go around the country teaching people, what I went through and, give support. So this is the kind of thing that I see that is so, so beautiful, really.
to me, I mean, again, what I'm hearing is that the healing process works, doesn't it? If you're willing
Yes.
to put the time in, the energy, and you're willing to somehow know that there is light at the end of the tunnel, then things will change. But if you keep fighting it and saying nothing, some people just almost they continue to suffer, and maybe at some point they get there. But you, as a therapist, a psychologist, and I assume there's others kind of getting into this whole idea of what
Yes.
you're, writing about. And
Yes.
so change can be happening. I mean, I know somebody personally that went through something, it wasn't a relationship, but went through something really horrendous a few years ago. And she did get some kind of therapy. And as a result, she changed, excuse me, she changed her whole attitude about life. And she's really like
Wow.
almost like a different person. She had the right
Yes.
person, to help her work through it rather than being, for a long time, she was like the victim, telling her story over and over again,
Yeah.
victim.
Yes.
So, I mean, it's good to know that your book has so much in it. Again, it's the unexpected gift of trauma. And maybe you aren't going through something like this, but somebody in your family, this is a good book to have, or to give.
Yes, it's a great gift, and people have been telling me really since the book came out how much they've been, companion to what they're going through, and they've given it to other people in their family or friends that have been going through. And one of the things about the support is not
Yeah.
just that you need support, like professional support, because people, people might think, okay, well, everybody has to be in therapy. Yes, of course I think everybody has to be in therapy. But I also believe in the power of relationships, meaning like if you have a great friend that you can talk to, if you have a group, a support group, like, like your community, that you feel embraced, that you have people in the community that can be with you.
Yeah.
Those are healing relationships. Those are the relationships that can be with you, that can really listen to you, that can actually validate what you're going through. And because this is what is needed, is the validation, the recognition that something happened to you. And for people to tell you, for somebody to tell you, I see you, I'm here for you. I can listen to you without judgment, without trying to change the story, without telling you that you're wrong or that you should be doing it differently. Just sitting with you and saying, I'm willing to listen, and I'm willing to stay with you in this pain, and to stay with you throughout the suffering until you're ready to move on. And that's a gift that you can give people when you do something like that.
Yeah, it really is a gift. I mean, this whole process is a gift, a different way of looking at life and not continuing. You've been a victim, when something terrible happens. But the question is, am I going to remain a victim? Am I going to keep on with the same story over and over again? And even if I don't talk to people about it in my mind, it's not
That's right.
just your mind,
That's right.
it's your whole being, right? Your whole,
Yes.
your way of
Yeah.
talking, of moving, it's your book is very uplifting, and it's groundbreaking in certain ways. I know you have is it the 5 steps of progression? And
Yes.
that's very interesting, how you progress. I think it's a little bit of it's a change from maybe traditional therapy, and it's something you've
Yeah.
worked with for a long, long time. And we could talk, I can see we could talk all day about this. It's really a pleasure, and it's very uplifting to get to meet a
Thank you.
like you. So again, I was saying Edith, but it's really Edith, right?
Yes, it's Edith.
Edith
Yeah.
Shiro, author of The Unexpected Gift of Trauma, The Path to Post-Traumatic Growth. And it's very, very uplifting to me to get to meet someone like you and know that this kind of work is going on. So
Thank you. Thank you so much, Meredith. Really, I appreciate so much this kind of conversations. And I hope that really this message gets out to as many people as possible, because it really, like you say, it's a message of hope, it's a message of uplifting, of like seeing the light at the end of the tunnel. It really connects people with themselves, with others. You know, it makes people feel not so lonely, you know, in the world, which, you know, there's so much loneliness these days. And that's another pandemic that we're going through, like, right, the disconnect. And then in allowing, you know, people to say, allowing us to have these conversations to say, let's stay more connected, let's be there for each other, let's understand like the meaning and the purpose of this, that it really makes a huge difference. I think it's a wonderful thing. And let, you know, and we didn't even talk about how spirituality gets even more developed when we go through this process. You know, that's a whole
That
other
was
thing.
the next question, but didn't get to it. We'll have to bring you back
Yes.
another time.
Yes.
Spirituality is, and that's what the Brahma Kumaris are about too.
Yes.
Is really about spirituality and going within and going beyond the physical, you know, as you do to go to get to that spiritual consciousness. And that's
And you know
help.
that do you know that there's so amazing studies in spirituality that show that once you go through this process of trauma and healing, you develop this protective factor that you have for future events, that when you have this spirituality developed, it protects you and become more resilient from, you know, when you have to face other difficulties, not just for adults, but we've even seen it in teenagers, in young adults, that it really makes a difference. And I cannot even imagine going through a process of healing without including spirituality and without allowing and helping people to get in touch with that, because we all have it. We all have that spirituality. It's ingrained in our nervous system, in our brains.
Beautiful.
It's something, yes, that we all should. I mean, there's some beautiful studies about even where is it located in the brain. And that's something that, again, and that's another gift that we get from processing trauma, which is getting this connection to spirituality. So yeah.
Well, thank you for adding that, because as you know, the Brahma Kumaris, their whole focus is on getting in touch with your spirit, with your inner, your soul, that's where true change happens. If you keep focusing on the physical and the, you know, you might get somewhere, but you might not get too far, that it's all going within and understanding who you are, why you're here, and what your purpose is. And so it's really a pleasure to kind of be on the same, not kind of, but we are on the same page, the Brahma Kumaris, and your work, your groundbreaking work. And you did mention, and we're going to say goodbye here, where you are, and you are a board member of the World Happiness Foundation. And what else? So many other, World Happiness Foundation, active member of Cadena International, providing humanitarian aid and disaster prevention worldwide. And you've worked at Bellevue, NYU Program for Survivors of Torture, the Cambodian Refugee Clinic, and the Human Rights Clinical Support Network at Refugee. So much. I just wanted to add a little bit. So really let people know that where you're at, which is really, you're about healing and helping others in the world. So thank you. And thank you everyone for tuning in. And I also, of course, want to thank our technical director, Dr. Amar. Thank you so much for helping out with this program. And Amar is an example of helping people. She's a pediatrician. Amy, Amar, just show yourself for a second if you can. She's a pediatrician. Part of the week and the rest of the time she's helping to run the meditation, the Brahma Kumaris Meditation Center, and helping the center in every way possible. So this is Amar too. She's an important part of our whole spiritual program and everything at the Brahma Kumaris in Miami. So thank you, everybody.
Thank you, Amar. Thank you.
Yeah.
Thank